the Toronto Star. I'm Sabah Itazaz, and this matters. It wasn't just the pandemic. A nursing shortage in Ontario has been predicted for years, but it's now a major crisis, and hospitals are seeing the real-time implications of what happens when nurses are exhausted, burnt out, and furious at the way they've been treated. We've all seen the huge price that frontline workers have paid during COVID-19. Nurses have been at the forefront of this battle in hospitals and long-term care homes. On top of the precarious work, they've also been dealing with rising hate, harassment, and abuse for doing their jobs. When we think of the early days of COVID, not many of us will forget those haunting PSA images of nurses after a long shift, haunted eyes, faces scarred by masks and PPE worn for endless hours. So why are those same nurses leaving the profession in worrying numbers? As staff vacancy rates keep rising, hospitals are struggling to clear a backlog of thousands of surgical procedures that were delayed during the critical waves of the pandemic. While COVID-19 has added to burnout and pushed nurses off the job, the shortage has been inching its way into hospitals across Ontario and Canada for years. The Star's data reporter Patty Winsa has been following this story, and she's here now to explain this crisis, its implications, and why Ontario's nurses are leaving their shifts for good. Hi, Patty. Thanks for joining me on the podcast today.
Hi, thanks for having me.
So let's start with what's going on. What's the current situation with staffing at hospitals and healthcare facilities in Ontario? How bad is the shortage right now? Can you paint us a bit of a picture?
Well, stats can kind of show that in the first 3 months of 2021, the healthcare and social assistance sector had the largest year-over-year increase in job vacancies, nearly 100,000 unfilled positions, an increase of 39% over the year before. And then the jobs with the largest increases in vacancies were registered nurses and registered psychiatric nurses. And half of those positions had been vacant for 90 days or more, meaning that they were fairly long-term vacancies and not easy to fill. And the impacts of that would be felt in Ontario, which historically has had one of the lowest ratio of registered nurses to population, 725 per 100,000 people. It's well below the national average of 811 RNs per 100,000 people, according to this 2019 data from the Canadian Institute for Health Information. And for hospitals, which are part of that sector, the vacancy rate is 10 to 12% for nurses, according to the Ontario Nurses Association.
So this has been an issue for quite a while, but this became a real problem during the summer, right? During the third wave of COVID-19, when hospitals were just scrambling to deal with this under-resourcing as patients with COVID-19 were being brought in.
Yes, there's always been kind of like a lobbyist, like Doris Grinspan. They're a nurses association who've talked about this problem, but it kind of became more grassroots towards the end of August. There was an open letter released to the Ford government from more than 350 doctors in Ontario that said the shortage of acute care nurses was impacting emergency departments across the province and causing entire sections of them to close regularly. And then around the same time, the Star received an anonymous email from a person who claimed to be a nurse in the GTA for 20 years. And she wrote that a Toronto ER, that typically scheduled 14 nurses at the beginning of a 12-hour shift, 7 of them. So that's when we started to look at the problems.
So this anonymous email that you got, could you tell me a little bit more about what it said?
She also said, later the same evening that when she was talking about it, she said there were only 3 nurses slated with the proper advanced cardiac life support training needed to work in a critical setting. So she was very concerned that people that needed that kind of care wouldn't have it, and that the risk of patients was being jeopardized.
So that's what got you digging into it as well. So this pandemic, as we know, might have amplified what could have been a long-standing issue in the healthcare system. This has been a while now, right? That this crisis has been there.
It has been. Doris Grinspan, who is CEO of the Registered Nurses Association of Ontario, and other nursing organizations, they've been speaking out about the shortage for years. As far back as 2009, the Canadian Nurses Association predicted that the nurse shortfall would reach 60,000 by 2022. And yeah, what I said before, it's different this time around. It's kind of become this grassroots movement, swell of activism where people in the profession were willing to speak out who might otherwise worry about the impacts to their job in doing so.
What are the reasons here? Why are so many nurses leaving the profession? Why are we dealing with this crisis?
Well, yeah, so the Registered Nurses Association of Ontario, they conducted a survey of more than 2,100 nurses at the beginning of the year. And they found that, 95.7% of respondents, so nearly all of them, reported high or very high stress levels. So there's the issue of being short-staffed, plus the long hours and the shift work, which make it difficult for nurses to have a life-work balance. And another problem cited by Greenspan and mentioned in the open letter from the doctors is the province's the Bill 124, which caps wage increases for nurses and other public workers at 1%. And, Greenspan says it's taking away the incentive for nurses to stay in a challenging profession made even more difficult by the pandemic. They feel that they aren't being compensated for their work.
And I'm sure the pandemic did not make it easier with high burnout rates and exhaustion just being exacerbated during this time, right?
Yeah, no, that same survey by the Registered Nurses Association, they found that more than 10% of nurses aged 26 to 35 have said they will leave the profession after the pandemic.
And how is this impacting the healthcare system now as more and more nurses are leaving? What kind of strain is the system in?
Yeah, I can't speak to the entire system, but Ruth Hagar, who is the Executive Vice President and Chief Nursing and Health Professions Executive at Sunnybrook, she was kind enough to speak to me. The hospital has 282 unfilled positions for registered nurses. That's a vacancy rate of 12.7%. The result, she said, is longer wait times in the ER because the department can be short anywhere from 1 to 4 nurses on any given day, and also longer, delays in some of the hospital's inpatient units. The situation, is being made more difficult because people have delayed their care because of COVID, and therefore they're coming in sicker and they're needing more care. And also, when I spoke to her, the hospital had a surgical backlog of nearly 5,000 procedures. And although there were enough surgeons to work on weekends or nights to clear it, there weren't enough nurses.
We'll be right back. There seem to be no quick fixes. I was also reading in your piece because it takes time to train new nurses, right? Can you take us through a little bit of what it takes to become a registered nurse in Canada? It seemed like a really heavy process.
Yeah, you know what it is? It's registered nurses. They have a 4-year degree so that they could typically deal with more complex patients in ICUs, cardiac care, emergency departments, or any other kind of specialty area. And they also require, they're also required to complete a certificate program after graduation for that specialty care. College programs for registered practical nurses take 2 years, and nurse practitioners are required to have a 4-year degree in nursing, followed by at least 2 years of practice and a 2-year master's program. And these university programs for RNs are small, relative to other university programs. There are 100 or 120 students annually that are admitted, so they're small.
So this is quite extensive. Also, we talked about new Canadians who might be qualified to get into the profession of nursing, but are not getting the proper credentials here. Is that another gap that could have potentially helped fix this critical staffing situation and it's not being looked into?
Yeah, it's definitely another piece of the puzzle. New Canadians, are managing the immigration system, which is federal, and separately licensing by the college, which is provincial, entirely on their own. And they are two different streams. If there was more coordination between the two that could expedite licensing by provincial colleges, that could definitely hasten people getting their licenses. And also government funding is essential. Provincial applications and exams plus upgrades to their education, it all costs money.
And you talk about this huge backlog as well at the National Nursing Assessment Service, I believe. Can you tell me a little bit about what that is? And can you give some examples of people you talked to who could potentially be working here right now, helping address this shortage if they hadn't been held up on this front?
Mm-hmm. Well, I talked to a couple of nurses who just contacted me after I wrote the first story because they just were kind of exhausted by how long it was taking and how much of an effort it was to get all of their documents together. So, I would guess that there's many more like them. But the assessment service, it's a Canadian not-for-profit which vets and authenticates the academic credentials of foreign trained nurses. So it verifies their identification, their education, their nursing employment information, language proficiency tests, and they had almost 7,000 applications in 2020-21. It was an 11% increase over the year before. And so about 10% of those people got caught in this backlog. The assessment service doesn't have any decision-making authority. It sends an advisory report to whatever provincial college the nurse is applying to. It's the provincial college which makes the decisions about whether the applicant is ready to be licensed or if there are requirements they need to meet, like upgrading their education before they can be licensed. And there is no national system in Canada that you can apply to, which, it just makes it even more complex. If a foreign trained nurse changes her mind and decides to go to another province, the applicant has to pay another fee and wait again to see what, that provincial college decides.
So there's a current backlog there. And I think you spoke to Lisa Conybeare, right, for this story?
Yes.
Who's in the States, and she wanted to come back and work here.
She did. She really wanted to come back she's from Ontario. She has 2 degrees there. One is, I think they're both masters. And she really wanted to come back to Ontario. And she started the process, a year ago, and then more than a year ago. And then, that she was sending all of these transcripts in and descriptions of the coursework that she had taken. And then they were asking her for more. And the thing about the NNIS is they do not actually start to process your application until they have all of the documents. And that takes a good 6 months. So it's a very long, involved process.
It's quite frustrating, especially as we're facing a health crisis at the moment as well. I know you talked about this in the context of Bill 124, which was a longstanding issue on, a lot of nurses thinking they got a bad deal on pay. What other steps are they talking about that can be taken to remedy the situation and improve the working conditions for them?
Well, the government is already allowing colleges to offer 4-year programs for RNs, and the province has increased enrollment by 10% for the next 4 years for RNs and RPNs, but not for nurse practitioners, which Doris Grinspan, CEO of the Registered Nurses Association of Ontario, would like to see happen. She'd also like to see the creation of bridging programs for PSWs who want to become RPNs, giving school credits for work experience, something they could also offer to RPNs who want to become RNs. And this is already being offered to nurses who work in long-term care. And Grinspan would like to see a number of initiatives to retain nurses. She said one is compensation, so do away with Bill 124 and let the unions negotiate. Second is decrease workload so people can provide good care and feel satisfied about their care, and not frustrated and exhausted. And third, she said build careers for nurses here in Ontario, which means giving them the ability to get more training and education and advance their careers.
Those are a number of important points to think about. Thank you so much for your time and your insight on this, Patty. Really appreciate having you.
Oh, you're welcome. Thank you very much.
I was speaking to the Star's data reporter, Patty Winsa. That's it for today. Thanks so much for listening. I'm your host, Sabai Tazaz. The This Matters team is Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Mudhar, and Sean Pattenton. Our music is by So-Called, Mike DeAngelis, and Sean Pattenton. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.